Hey guys, I'm back with another video, and in this video I thought I would just do like a fun video on some of my favorite nursing school apps, things that have really helped me retain a lot of information and like hone my study skills and just kind of help me study on the go, whether I'm at the hospital or I'm like, I don't know, waiting to get my car serviced. There's always other things I could be doing to retain more information. So these are my favorite nursing school apps. So this is my phone, iPhone 7 Plus, and we're gonna go straight into it. So this is my home screen, and this is my nursing folder. So this is where I keep all my apps, super accessible. Click. Alright, so these are the 6 apps that I use the most, which are Quizlet, uCentral, NCLEX RN, The Countdown, Panapto, and ChartSpan. So we're going to start off with Quizlet. So Quizlet is such a good resource. Like, I don't know why more people don't use Quizlet, but if you're like me, you enjoy using flashcards to study with. I've been using like flashcards to study with since I was in undergrad, and it's just the best way for me to learn any material. So I've been using Quizlet for a while now, and I hate traditional flashcards because 1, my hand hurts, and then 2, I have to carry around so many freaking flashcards and I lose them. Like, once I'm done with the class, I put that stack of note cards somewhere, and eventually it starts blending in with its surroundings, and then it gets messed up, and then the card gets bent, and then I really don't want to use them anymore. So I don't really care for traditional flashcards. So Quizlet is such a great option because 1, I can type it, and I'm very much like a techie nursing student. Like, I don't really write notes while I'm in class. All my notes are taken on my laptop. I bring my laptop to class every day, and I take notes directly in the PowerPoint while I'm in class. Using Quizlet is just a great app in general. And some of the reasons why I love Quizlet is because, number 1, I can keep all of my flashcards in one place, super organized. So as you can see here, maybe you can't see it, I have a nursing school class for every single nursing school course that I've taken thus far. So I can click in my class, and then I can look up all of the flashcards that I made up for that course, and it's just so easy to go back and revisit some of my old flashcards. So for example, when I was taking psych nursing, I remember that I learned a lot of psych meds while I was in pharm, and instead of creating a whole new instead of creating a whole new flashcard set for psych meds, I just looked back at the Quizlet that I made while I was in pharm, and I was able to review it, and it refreshed my memory, and it was just great. That is the beauty of Quizlet. And then in addition to that, you can share these resources with whomever you want. Like, I personally share my resources with all of my classmates. We have a group me together, and I'll just post a link to my Quizlet in the group me and say, hey guys, I made this, use it if you want. If you don't want to use it, that's fine. And we're all able to facilitate studying and just bounce ideas and concepts off of each other. And another reason why I love Quizlet is that you can test yourself with your own Quizlet. So I'm gonna look at my most recent Quizlet, which is endocrine medication. Well, it's actually spinal cord injuries. So I'm gonna click on spinal cord injuries, and you can see these are all of my flashcards that I made. It'll also speak to you, so it talks back. It's not talking now. I don't know why.
The patient mean a lack of perfusion to the brain.
Okay, and you can star cards that you want to study some more, I guess. So like I start that one, like maybe I was having issues retaining the information, so I'll go back and start and then revisit all of the hardest cards later. And you can test yourself on this knowledge. So if I go all the way to the top, you can see it says spinal cord injury, and then I can use the cards, I can learn it, I can play a matching game, or I can test myself on the flashcards. So it's just a really great resource, and I love that I can keep it in my pocket, because if I have downtime in between like doing a skill at clinicals, or if I'm just at Walmart waiting in line to check out, I can be on my Quizlet reading information. So love Quizlet. Probably my favorite nursing app next to NCLEX RN. But no, Quizlet's probably my favorite nursing app. All right, so next to that I have uCentral, and this is an app that came with it came out of the tuition that I paid for my program. So basically, instead of us carrying around a Davis drug guide, this app has a whole bunch of resources in it. So there's notes that I can write, I can favorite certain medications, and then this is what I use the most, which is the Davis's drug guide. And there's also a calculator and some other things, but I really like using the Davis's drug guide because everything that you would want to know about a medication is in there. So let me look up a quick med for you. I'll look up prednisone. So type prednisone, and this is what comes up. It gives you, probably can't see it that well. It gives you the generic name, what the medication looks like, some of the trade names, the pharmacological classification, the therapeutic classification, mechanism of action, what is it supposed to do, the therapeutic effect, and it goes on and on. And it has like drug interactions. It has drug interactions, like, okay, the effect it's supposed to have for adults and children, and depending on the medication, it'll say how it's supposed to act depending on the route that it was given. What do you need to assess before giving it? What do you need to implement? What do you need to teach the patient? What nursing considerations do you as a nurse have? So literally everything you would want to know about the medication is in this app. And in addition to that, I don't have to carry around a huge Davis drug guide and app updates. So if there are changes to the medication, or I don't know, something has changed, the information is automatically updated. Whereas, the medication textbooks can get outdated. So this is the latest information and it's all in my pocket. So if I don't understand a medication, I'm going to go in the corner and I'm going to look it up. And I'm going to make sure I understand it before I look dumb, number one, or two, give it to a patient. You shouldn't give medications that you don't fully understand to anyone because that can be harmful. So love that app. Then we have the coveted NCLEX RN app over here. Oops, sorry. If they don't cooperate over here. And I recently got this app, probably within the last 2 months, and I really honestly sooner. Didn't know about it at the time. So this is a really cool app. I use it to test my knowledge. They have different sections that you can use. And what I'll do is, like, once I'm done with the topic, I'll go back and I'll do all the questions I can on that topic to make sure I really grasp the information. So, like, let's go to maternity. So I'm going to go to maternity, and if I want to test myself on newborns or labor and delivery, then I'll answer all the questions from there. And it's just such a great resource, and this is really going to help you do well on the NCLEX, and it's also going to test your knowledge to make sure that you actually understand the content and you're not just learning the material based off of your program's curriculum, because like we know the NCLEX isn't based off of any one program's curriculum. It's just a culmination of topics and content that every prudent nurse should know. So apps like this help test your knowledge. So go out and get NCLEX RN, and they usually have like really good deals where instead of paying $30 for the app, because nobody got time to pay $30 for an app, you can get it for like $15.99, because I got it for $15.99. And then I have Chart. Well, this is just like an app that I use to keep all of my medical records, like immunization, so that if maybe my clinical instructor wasn't able to pull up my immunizations, I can just look it up and show her the documents on my app, and that way she knows I'm clear to go to the hospital. And then we have Panapto. Panapto is this green trash looking thing. This green trash looking thing in the middle, if it would focus right here. Okay, and I mostly use this app. This is like a program specific app. So the professors at my nursing program use Panapto to record lectures. So instead of students putting out recorders, most of the lectures are recorded on Panapto. So It's a great resource. I mostly use it while I'm driving because my commute to my campus is about anywhere from 30 minutes to an hour and a half depending on the time of day and traffic conditions. So instead of like listening to the radio or my iPod, I listen to Panapto and just try to absorb the material while I'm driving. Or if I'm showering, or if I know I'm going to be doing something for a while, like cleaning the bathroom, cleaning my room, I can put on Panapto and listen to the material and try to, gain more information or just keep revisiting the material because repetition does help. So that was Panapto, and as you can see, there are all kinds of lectures here that aren't even related to nursing. And the other good thing about Panapto is that, well, at least in my program, they don't delete their Panapto. So I can listen to a lecture from yesterday, or I can listen to a lecture from 2009. And I actually like listening to some of the old lectures because they explain the same content sometimes in a different way. And it really helps me retain the information. Because all of this is about retention. It's one thing to really understand the system or the topic, but it's another thing to retain it because I need to remember all this for the NCLEX. And that's the end goal, is to pass. And then I have my last nursing school app, which is in the corner right here. Ooh, right there. And I got out of it, sorry. Countdown. So as you can see, the first countdown I have right now says 72 days until nursing school pinning. And then I have another one that says 23 days until my advancement certificate, and then 56 days until my exit HESI exam. And I mostly use this app for motivation, like if I'm feeling discouraged about studying, or I don't know, I'm just having a really hard day and I just am over school and I want to be done with it. I look at this app and it's kind of just like, girl, you're almost done. You're almost at the finish line. Just hold out a little bit longer. You can do this. So those are my favorite nursing school apps. If you have any apps that you love or you enjoy and that help you get through nursing school, please leave them down below or comment below, and let's just share the wealth, If you like this video, give it a thumbs up, and I will catch you in my next video.